Here at RI, we have phrases that we use that informs our day-to-day operations and the way that we treat our staff and the way that we treat our guests. But it's not just buzzwords for us. It is our actual way of life to inform the way that we run our shifts, our units, and how our staff sees their work day in and day out.
Our Durham location would be the closest thing we have to a campus of connection. We have 3 ongoing services here currently. So we have our 23-hour observation unit or our retreat. What they're doing in that 23-hour time frame is looking to determine, does this person really need to be inpatient with us? Do they need a higher level of care? Or do they need to be referred back out to their primary care physician and/or specialist? Roughly 55% of the individuals that present to our 23-hour unit discharge from that unit. The other 45% are those that really need that additional TLC from us, that tender love and care, and they move over to our facility-based crisis unit, which is also called the living room, and they tend to stay for roughly 3 to 5 days to ensure that they are stabilized. We also have outpatient services here. So they come in for talk therapy, they come in for medications. So this is, our Durham location is the closest thing we have in North Carolina to that campus of connection, really that one-stop shop.
While most guests check into us through the front door, we do have what we call a crisis entrance, and this entrance is specifically for first responders that are bringing guests to us for services. We welcome EMS, we welcome police drop-offs. Durham County has what we call the HEART team. We call that our no wrong door policy. We don't want anybody to be sent away at the door. We want to have welcoming arms for anybody that's coming to seek services from us.
Jacksonville has a 16-bed facility-based crisis unit, so they are inpatient only. Jacksonville services 29 counties, so that's a lot of counties, and they're also in a very rural area.
Jacksonville seems like a big city, but it's a big small city. There are several bases here, and of course, a lot of civilian families. We are the only detox mental health stabilization center. It literally is a recovery response center. Our guests here are allowed to guide their own care. It's all about making sure the guests get the best care that they can.
The Cumberland Recovery Response Center is located in Fayetteville, North Carolina, and is named after the county that it is located in. It is a 10-chair retreat unit and also has a 16-bed facility-based crisis or living room unit that is slated to open very soon.
I've been working here about 3 years, and since I've been working here, there have been a lot of changes, but one thing that has always been constant is the RI way and standing to that. Here, we want to make sure that people are comfortable, and the RI way ensures that we're doing that in the safest and most appropriate manner to help the guests so they can continue a journey of healthy living.
We are able to address not only the presenting concern, but we also address those socioeconomic concerns as much as possible and to try to give them as much resources as we can. And we kind of figure out different ways of problem solving as an interdisciplinary team, how we can approach and try to address those issues for them.
I used to work at a mental health hospital before, but I never quite felt like that was the place for me. I realized it's because I have always been a peer. And when we say we understand, we mean we actually understand because we do have that lived experience in this area.
We work collaboratively for our guests. We don't operate in silos. Every single role has an important part to play, and no person's role is more important than the other.
This is just 3 examples across North Carolina that focus on mental health, substance use services, urban areas, military communities, rural areas. It really depends on the community and that community expectation. The RI way is paramount throughout everything that we do, and this is just an example of how it is brought to life and how it is showcased in our work every day.